Thank you, Bill. Tonight, your health, and officials say the number of people using heroin in the U.S. has grown by about 300,000 over a decade, and that comes from a new report from the Centers for Disease Control released today. According to the report, heroin use more than doubled among young adults ages 18 to 25 over the past decade. Between 2002 and 2013, the rate of heroin-related overdose deaths nearly quadrupled. The study says that 45% of people who used heroin were also addicted to prescription opioid painkillers. And it says that heroin use has increased among almost all demographics. Most of the increase, though, in whites across all income levels. Joining us tonight in studio, Brian Keeley. He's with the Grand Rapids Red Project. That's a local nonprofit. You just saw those stats. In a nutshell, what's happening here, Brian?
In a nutshell, this is a part of the opioid epidemic. So heroin is an opioid, and along with prescription medication, opioid fatalities, and the epidemic, this is also increasing, especially in the last few years. At the Red Project, this is something that we've been following and that we've also been addressing for the last 15 years, very successfully with syringe access programs to decrease the rate of disease transmission, as well as naloxone. Since 2008, we've been able to prescribe naloxone or Narcan, which can actually reverse an opioid-related overdose, saving someone's life.
Okay, there's help out there, and there's resources to take advantage of. Yeah. Yet we definitely want to talk about that. But talk about this relationship between the synthetic opioids and heroin, and what's going on here back and forth between, is it addiction necessarily to painkillers, and then they switch to heroin, or vice versa? What's going on? There's
a combination. Every individual's story is going to be different. There's individuals that start on heroin, there's individuals who start on prescription medications and move to heroin. It's definitely a much more affordable option than prescription medications. And at the same time, you know, there's a start with the use of prescription medications that can lead to addiction, or start with the abuse of prescription medications or misuse of those, and that leads to a chemical addiction. Once you have a chemical addiction, though, that's going to be something where you need, really what we need increased access to is medically assisted treatment options, and in order to address that.
I was going to say, talk about how powerful this addiction is, because sometimes these people are kind of demonized, but in essence, aren't they victims?
So it's a disease and it's an illness. And so when you look at it from an illness, there's multiple ways that you can treat this disease, an option. And most of the time, it's never going to be easy when it comes to chemical addictions. And most of the times, it's so hard and so challenging for the family, for the friends, for everyone surrounding them. And a lot of times, the option to, push those individuals away has to happen on some sort of levels, but at the same time, those individuals need all the services, options available to them, and that's where it comes really the challenge when it comes to substance use and the substance use disorders. Is how do you balance that? How do you make sure these individuals are getting all the services they need through that illness?
Brian Keeley, you're with the redproject.org. That's where you can find help. Resources are available out there. Definitely take advantage of them.
Yes, lots of information on our website and lots of ways that you can help out and contribute to the Red Project, both in our services as well as financially.
Brian, thanks for your time tonight.
Thank you so much.